Effective communication is essential for coordinated and efficient care within the health team. Sharing information about what has been done for the patient, what needs to be done, and the patient's response to treatment ensures that everyone involved is on the same page. This lecture will explore the importance of communication in healthcare, the rules for effective communication, the role of medical records in maintaining accurate and legal documentation of patient care, and the nursing process. Importance of communication in healthcare. Communication among health team members is crucial for providing coordinated care. For instance, when a patient requires comfort measures, the nurse may plan to administer a pain relief drug and ask a nursing assistant to position the patient. The nurse explains the plan to both the assistant and the patient, administers the drug, and evaluates the patient's response. The assistant then positions the patient and reports the care provided. This information is recorded and shared with the next nurse on duty, ensuring continuity of care. Effective communication allows the patient to know what to expect and ensures that all team members are aware of the care provided. Rules for effective communication. To communicate effectively with the nursing and health teams, it is important to practice certain aspects and rules of communication. These include using clear and specific language. Words should have the same meaning for both the sender and receiver. Avoid words with multiple meanings. Seeking clarification. If a message is not understood, ask for clarification. Understanding medical terms is essential for effective communication. Being concise. Provide information that is relevant and necessary. Avoid adding unrelated details. Organizing thoughts. Present information in a logical and orderly manner. Providing specific facts. For example, reporting a pulse rate of 110 is more specific than saying the pulse is fast. The role of medical records. Medical records, whether on paper or electronic, are legal documents that provide a detailed account of a patient's condition and response to treatment. These records are used by the health team to communicate information about the patient and are often reviewed by government and accrediting agencies to ensure standards are met. Medical records can also be used in court as legal evidence. The medical record includes various parts such as the admission record, advance directives, health history, nursing assessment, care plan, progress notes, flow sheets, medication administration record, physical examination, orders, laboratory results, X-ray reports, therapy records, consultation reports, special consents, and discharge summary. Each part contains the patient's identifying information and details about the care provided and the patient's response. Legal and ethical aspects of medical records. Agencies have policies regarding who can access and record information in medical records. Only professional staff involved in a patient's care can review charts, and nursing assistants may be allowed to record observations and care depending on agency policies. It is essential to keep information confidential and respect the patient's right to privacy. Patients and their legal representatives have the right to access their medical records, and requests to see the chart should be handled by the nurse. The nursing process. The nursing process is a method used by nurses to plan and deliver care. It includes assessment, analysis, planning, implementation, and evaluation. Nurses gather information about a patient's care needs, make decisions using nursing judgment, plan and carry out measures to meet those needs, and evaluate the outcomes. The process is ongoing, with new information gathered and needs changing over time. Assessment involves collecting information about the patient. The nurse takes a health history, reviews information from the doctor, and assesses the patient's body systems and mental status. Nursing assistants assist with assessment by making observations during care and reporting these to the nurse. Observations include using sight, hearing, touch, and smell to collect information about the patient's condition. Analysis involves interpreting the collected data and identifying problems. The nurse uses nursing judgment to determine what is normal and abnormal. For example, vital signs are compared to normal values to identify any issues. Nursing diagnoses describe health problems that can be treated by nursing measures, while medical diagnoses are identified by doctors and treated with drugs, therapies, and surgery. Planning involves setting priorities and goals for the patient's care. Goals are aimed at achieving the patient's highest level of well-being and function. Nursing interventions are actions taken by the nursing team to help the patient reach these goals. The nursing care plan is a written guide that includes the patient's problems, goals, and nursing measures for each goal. Implementation is the step where nursing interventions are carried out. Nursing assistants perform tasks assigned by the nurse, following the care plan and assignment sheets. Effective implementation ensures that the patient's needs are met and care is provided consistently. Evaluation involves measuring whether the goals set in the planning step were met. Assessment information is used to evaluate progress, and changes to the care plan may be made based on the evaluation. Reporting and recording. Reporting and recording are vital for effective communication within the health team. Reporting involves giving an oral account of care and observations, while recording involves documenting these details in the medical record. The 24-hour clock is often used for recording time, and it is important to follow agency policies for reporting and recording. Report care and observations to the nurse when there is a change from normal or a change in the patient's condition, when the nurse asks you to do so, before leaving the unit for breaks, before the end of shift report, and after the end of shift report. Be prompt, thorough, and accurate in your reporting, and use your written notes for a specific, concise, and clear report. When recording, follow agency policies and procedures. Include the date and time for each entry, use correct spelling and grammar, and be accurate, concise, and factual. Record only what you observed and did yourself, and never chart a procedure, treatment, or care measure until after it is completed. Use the patient's exact words when possible, and chart changes from normal or changes in the patient's condition. Effective communication is the backbone of coordinated and efficient healthcare. By following the rules of communication and maintaining accurate medical records, health team members can ensure that patients receive the best possible care. Understanding the nursing process and the importance of reporting and recording helps create a seamless flow of information, ultimately improving patient outcomes and maintaining legal and ethical standards in healthcare.